Over the past few weeks, two major stories have caught the attention of international dentists preparing to work in the UK. First, significant changes were introduced to the LDS examination. At almost the same time, ORE candidates continued reporting booking problems, delayed confirmations, and technical issues. For many overseas dentists, this is not just another news story. These exams determine careers, finances, and for some people, even future immigration plans. So, in this video, I'm going to break everything down in simple language that what changed, why candidates are concerned, what the official organization have said, and most importantly, what this means for you. So let's begin. But before starting, please subscribe my channel since a lot of people just are casual viewers and they have not subscribed my channel as I'm doing my best to update you about everything about LDS and ORE exams. So, at first glance, these might seem like two completely separate issues of, LDS and ORE, but one is about the LDS examination, while the other is about ORE booking. But if you look a little closer, they have something in common. Both affect the journey of internationally qualified dentists trying to enter the UK dental workforce. On one side, LDS candidates are adapting to a new assessment format. On the other, ORE candidates have been dealing with repeated booking difficulties. So, different problems, but the same people are being affected. That is why it is important to understand both. So, what actually changed in LDS? So, let's start with LDS from spring 2026. The examination moved to align with the Journal Dental Council Safe Practitioner Framework. One of the biggest changes was in Part 2. The previous unseen cases component was replaced with a new structured clinical reasoning assessment. The goal of this change is to assess candidates more clearly on how they think through clinical situations, make decisions, and demonstrate safe practice. So, on paper, that sounds like a reasonable objective. However, the introduction of a new format also raised questions from candidates about how best to prepare. So, what is the Safe Practitioner Framework actually is? You may have heard this phrase many times recently, but what it is? The Safe Practitioner Framework is designed to define the knowledge, judgment, communication, and professional behaviors expected from a dentist who is safe to practice in the UK. In simple terms, it is not only about remembering facts, it is also about making appropriate clinical decisions, communicating effectively, and putting patient safety first. That is why newer assessments are placing greater emphasis on clinical reasoning rather than simple recall. So, if you are preparing for LDS or even ORE, this shift in focus is something you should be aware of. So, why are candidates concerned? This is where much of the discussion began. Several candidates told dentistry.co.uk that although the examination format had changed, they felt there was not enough guidance to help them prepare. Some said they were expecting sample cases or clearer examples of how the new clinical reasoning component would be assessed. Others wanted more information about marking and more detailed feedback after the exam. It is important to note that these are concerns reported by candidates. At the same time, the Royal College has explained that the changes are intended to improve the assessment and ensure it reflects the standards expected for safe dental practice in the UK. So the conversation is not simply about pass or fail, it is about balancing high standard with transparency and helping candidates understanding how they are being assessed. So, if this video is saving you time or help you what is actually happening, I would really appreciate your support. So please take some seconds and subscribe to Last Night Dentistry. Now, moving forwards, that what candidates are saying. So, now let's talk about what many candidates shared after receiving their result. Several candidates told dentistry.co.uk that they were disappointed not only because they failed, but because they did not understand why they failed. Some felt the feedback was not detailed enough to help them improve for the next attempt. Others said they wanted greater transparency about how the new structure clinical reasoning component was assessed. One candidate summed it by saying, I'm not asking for special treatment, I'm asking just for transparency, accountability, and fairness. Whether you agree or disagree with these opinions, one thing is clear. When a new exam format is introduced, candidates naturally want clear guidance on how to prepare. So, did the pass rate really drop? This is probably the biggest question everyone has been asking. Many candidates reported that the pass rate appeared to be much lower than in previous settings. Some even claimed that only a handful of candidates passed from a much larger group. However, this is a very important point. These figures have not been officially confirmed by the Royal College and could not be independently verified by dentistry.co.uk. So rather than spreading rumors, it is better to focus on what we do now. The exam format, has changed. Candidates reported concern, and naturally, many people are now waiting to see future results to understand whether this was an isolated setting or part of a longer term trend. Whenever official statistics become available, I will make sure to cover them here on the channel as well. So, how did the Royal College, respond? So they responded to these concerns. Their message was clear. They acknowledged that changes to the examination may be challenging for candidates, but they also explained that the purpose of these changes is to ensure the exam accurately assesses the knowledge, clinical judgment, and your professional behavior expected from a dentist who is safe to practice in the UK. So, in other words, their priority is patient safety and maintaining professional standards. So, at the moment, we have two perspectives: candidates asking for more guidance, and Royal Colleging emphasizes the importance of maintaining a robust assessment process. So, this is, about more than an exam. One thing I think people sometimes forget is that these exams affect much more than just an exam result. For many international dentists, passing or your LDS is next step towards your UK journey. It can influence your career opportunities, visa timelines, family decisions. That's why changes to these examinations receive so much attention. When candidates ask for clear guidance or transcription, sorry for that, transparency, it's often because the outcome has a significant impact on their future. So this is one of the reasons I want to keep covering these updates on the channel. The more informed you are, the better prepared you will be. So prepare. Let me just add the cost of the journey to tell everyone that why these are a big concern. So UK registration is not just emotionally demanding; it can also be financially demanding. Between examination fees, study materials, preparation courses, travel, visa-related cost, and registration expenses, the total investment can be substantial. Some discussion within the profession have estimated that the overall journey for certain candidates may reach £15,000 to £18,000 depending on individual circumstances and preparation choices. That's a significant commitment, which is exactly why making informed decision at every stage is important, and that's also the purpose of this, channel. Now, coming to the ORE part, while all of this was happening with the LDS exam, ORE candidates were facing another challenge again. The second time they have faced that, many of you will remember the booking window at the end of the June. Candidates reported overloaded servers, payment issues, error messages, and in some cases, payment being processed without an immediate booking confirmation. Then, before the next part, 2 booking window. The JDC delayed the release by a week so further testing could be carried out. Even after that delay, some candidates continued reporting technical issues during the booking. These were not isolated comments either. Similar experiences were shared by many candidates across different online communities. So, what did the JDC say? The JDC also responded to these concerns. They acknowledged that changing the booking schedule should be unsettling and apologized for the inconvenience caused. Before reopening the booking window, before reopening the booking window, the informed candidates said some performance issue could still occur and provided guidance for situations such as unsuccessful payment messages. Perhaps the biggest announcement was this that I have also covered a video about this. The GDC plans to introduce a completely new booking portal for examination scheduled from 2027. The aim is to improve the booking experience and reduce many of the technical issues candidates have experienced. So, what does this mean for you? After hearing all this news, it is easy to feel overwhelmed, but here's what I want you to remember. If you're preparing for LDS or ORE today, don't let today's headlines distract you from tomorrow's goal. Stay informed, prepare consistently, and avoid making important decisions based only on rumors. So, my personal advice on this is if I were preparing for these exams today, I'd focus on the things I can actually control. I had studied the syllabus thoroughly, I built a strong clinical reasoning skills, I had practiced consistently, and I'd keep myself updated through official announcement instead of reacting to every rumor online. That's exactly the approach I want this channel to promote. Less panic, more preparation, less confusion, more clarity. So, the future of UK dentistry, despite the challenges we have discussed today, the UK continues to rely on internationally qualified dentists and overseas professionals are expected to remain an important part of the future dental workforce. That means these examinations will continue to evolve, booking system may improve, and assessment methods may change, guidelines will be updated as well. So, just at the end of the video, before you leave, I'd like to ask you one question. Do you think the new LDS assessment should include official sample cases and more detailed feedback for candidates? So, thank you for watching, and I will see you in the next update.